trabalho en the Public Health Institute em Califórnia. Falo muito bem espanhol, mas não falo muito bem português, então vou fazer minha apresentação em inglês. Eu acho que começamos em inglês e vamos terminar em inglês o dia. Então, tenho mais de 17 anos trabalhando em MPH, Estados Unidos, principalmente dirigindo programas de capacitações de liderazgo, líderes também, de apoiar a diferentes sistemas e todo em saúde pública, principalmente em Latinoamérica e também em África. So now I'm going to switch to English. So Andy Pines, our board member, at the beginning talked to you about our approach at the Public Health Institute. And I think just to show this slide again, and what we've been talking about all today is really the focus on partnerships that we have at the Public Health Institute. And the Public Health Institute was actually started in partnership with the state of California. So with our state government as an effort to help the state government implement their programs. So as we've been talking about, and as Dr. Fatima was saying, the challenge for state and federal governments in implementing a lot of their programs, unless they have good partnerships with local civil society organizations or local industry partners. So PHI really started that way, and we continue to really focus on partnership building, on capacity building and leadership, on coalition building and convening, and on leveraging technologies, which you were saying earlier, the importance of leveraging technologies and being a partner with industry as well as with innovative social entrepreneurs in leveraging these technologies to do our work. So we've been obviously speaking today about the importance of NCDs and the large burden of NCDs around the world, in Brazil, but also in the United States. And so, as we mentioned, heart disease and diabetes and chronic disease, hypertension, all of these are leading causes of mortality in the United States, and that's why PHI emphasizes, and we really focus from 40 to 60% of our work on fighting chronic disease in policy work, in research, and in implementing programs on the ground in communities, and often in the underserved, most marginalized communities that we were speaking about earlier in the Health Rise program. So one of the areas that we really focus on and why we're here is because we focus on capacity building and leadership development and developing fellowship programs for different agencies that need to increase their capacity in public health. Or increase their capacity to be able to partner. So our partnership with the Medtronic Foundation through this Global Health Leaders, which is making this forum today possible, it's an innovative partnership, we believe. It's helping to bring more local public health expertise into Medtronic Foundation. And it's also giving us an opportunity to really come and learn from your experiences here in Brazil, and hopefully take those experiences back to the United States, where we can work with Brazilian populations and other Latin American and just the general American public, learning from your experiences. So we have many different fellowship programs, many different leadership programs, as Andy was saying. With the U.S. government, we're one of the larger implementers of their fellowship programs, sort of deploying Americans into USAID embassies around the world to act as fellows. We also work with the Academy of Nutrition and Dietetics with some sponsorship of Abbott. We're working with the AstraZeneca funded youth fellowship leadership program in Kenya. So we have many different leadership fellowship programs that focus on this. And we're really interested in increasing our capacity and increasing our work in Latin America and contributing to the efforts that you have here. And two years ago, as we founded an actual PHI here in Brazil. So now we have a Instituto de Saúde Pública Brasil. So we're really, as a local registered nonprofit, so we're looking forward to using that to leverage our continued support of the work that you're doing here. And as Andy said initially, not duplicate efforts, but contribute what we can, whether it's best practices in chronic disease that we have working in California or in the US, or whether it's multi-sector leadership development. And so I'm going to talk about 2 or 3 different models that we have and where we're bringing together sectors to fight NCDs. So one of our, as we've discussed here in this forum, the complexity of community health issues, and particularly NCDs, really requires the collaboration of organizations from multi-sector. So the public sector, the nonprofit, academic and universities, private and public universities, the business sector, because really no single sector or no single actor, including health, can solve all of these problems alone, right? So it's not just the responsibility, obviously, of the state government or the federal government in health to solve these problems. And we really need the support of industry, of the civil society to work together to really improve community health and increase health equity. So we work on policy change, on systems change, incorporating innovation, and we join together with many different sectors. So one of the programs that we have that we think could be a very good model for you in increasing your collaboration across sectors here is our Center for Health Leadership and Practice. And we have a National Leadership Academy for the public's health, which brings together teams of leaders from the different sectors to solve a specific problem and to design a specific project. So it's very similar to HealthRise. HealthRise could have been a project that would have come out of that type of multi-sector leadership development projects. So this is a program that we have implemented all across the United States. We have over 120 different multi-sector teams across the U.S., where 450 people have really participated. And the teams are usually 4 people, so you have a public health department, an academician or university, nonprofit. You can have a patient advocacy groups, private hospitals, private businesses, and so they come together to design a project, or they come into this leadership program with a project that they're already working on that they need to increase the trust among themselves. They need to learn how to work even more efficiently and learn new strategies. Most of the work that the Center for Health Leadership and Practices has done, and these teams have actually been focused on chronic disease because of, obviously, chronic disease being leading causes of death and disability. So what these teams do is they also allow health departments to get closer to the ground and to the reality. So you were saying it's challenging for federal government sometimes to actually be on the ground and know what's happening. So bringing people from state governments, from federal governments into these cross-sector teams allows them to also share their perspectives and experiences. So some of the, what have been some of the results of these projects that have worked across the United States, these cross-sector approaches? So one of the teams in New York City had successful policy change to create smoke-free housing in New York City. So they actually worked with housing authorities and private apartment owners to actually implement policies so that there would be spaces where there would be smoke-free spaces to be able to reduce cancer and associated health outcomes. So that was one of the successful projects. Another was a team in Georgia where they reduced the emergency room visits due to asthma through a home visiting program. And that was a team that had hospital, emergency room physicians, patient advocacy groups, public health department, the Department of Education, which I was speaking earlier with some of the Ministry of Health colleagues here, and they were talking about the efforts that the Brazilian government does here to really work, the Ministry of Health and the Ministry of Education, to put together school-based health programs. So these, the important thing I think is some of these teams don't necessarily have the health department as the primary lead always. Sometimes it's private, sometimes it's the nonprofit organization that's really leading that. So I think that we've seen that this sort of cross-sector leadership development approach, it really creates that synergy and allows the different sectors to share their strengths and their resources to solve these problems. So another, obviously our focus is on non-communicable diseases at PHI. Another project we had is called CA for Health, and it's the Community Transformation Grants. And this was another public-private partnership to improve community health. And it was funded by the Center for Disease Control. We worked in 12 different counties around California, mostly with rural populations, so similar to the populations probably where HealthRise is working in the northeast of Brazil or in the state of Bahia, but harder to reach and less educated with worse health outcomes and more health disparities. In communities with lack of good housing, lack of areas of physical exercise, and lack of access to affordable food. So the primary 4 strategies here for this project were reducing exposure to secondhand smoke, decreasing consumption of sugary beverages, increasing opportunity for children and families to incorporate daily physical activity, and improving clinical community linkages and ability for people to manage their chronic health conditions. So I think this is very similar to a lot of the projects that you were talking about, Dr. Fatima, that the government is working on in terms of school-based work. And who were the partners? So in this project, the health department was the local health departments were the lead, but then there were hospitals and patient groups, private hospitals, housing authority, schools, Rotary clubs, different departments of the government, planning department, for instance, and physician associations such as cancer and lung associations. And then also food vendors, right? If we're talking about getting food into schools or changing the way that the food is going to be in the schools, food vendors were also partners. So they had different results here as well. Smoke-free multi-unit housing, increasing access to water, and decreasing access to sugary beverages in schools. And there's a photo here of one of the campaigns around that. Increasing walkability of communities, physical activity, and increasing chronic disease self-management. And we use the Stanford Chronic Disease Self-Management Program of evidence-based programming, which would be an excellent, I think, program to highlight next year in your forum of best practices. So PHI, as the lead here, was able to bring in funds and then work directly with the Ministries of Health and the local public health departments. We were able to help sign MOUs for public-private partnerships, and then to really implement these policy systems and environmental changes. And these communities were really successful because they leveraged pre-existing resources, and they created non-traditional partnerships. And I think that's what we're talking about here too, today is not just the normal partnership, but how do we create non-traditional new partnerships for this. So we have, I know my time is almost up, we have quite a few different programs that work domestically as well as globally. Some of the things we've done globally is contributed to the Pan American Health Organizations as a technical expert in areas around chronic disease. And we've worked throughout the Americas on taxation of sugar-sweetened beverages, which has involved discussions with food industry, not always easy, as you were mentioning, the sugar industry and beverage industry and food industry, but a very necessary partner, obviously. Also working on salt reduction and we're a part of the National Salt Reduction Initiative partnership, which does include industry on a volunteer basis. So I think we have many. If you go to our website, we have many, and you look under if you go to Public Health Institute, so phi.org, and you look under chronic disease, I think Andy was mentioning we have between 20 and 40 chronic disease programs that are being run at any one time. I would say the majority of them have partnerships across different sectors. So we would love to contribute some of that evidence or strategies with you and in the future. We are very enthusiastic, I think. As I've been to Brazil a few times, this is my second time in Sao Paulo, and I came early this time to actually visit the museums and the MASP and to go to the Sala São Paulo to see the symphony the free symphony on Sunday mornings. So it's a beautiful city, and we're looking forward to continuing to work here and to support you, and to really support your intersectoral collaborations to improve NCDs, to share our successful evidence-based models and those of our other colleagues, such as Kaiser Permanente, and where we can, I think, bring in some expertise and some resources into future projects here, and to learn from you to really improve the lives of people also back in the United States. And so we really continue to look forward to working with Dr. Barone and having him as both representative of the Public Health Institute here, expanding our Instituto de Saúde Pública Brasil, and just want to really thank you for the inspiration that you've given us today. I think Andy and I take a lot back of learning about how the health system works here, how the universal, really the idea of universal health coverage obviously is not a reality in the United States, and so it's interesting to hear, what the higher values are here, but also how it's being implemented and some of the challenges there. So I think we go humbly with a lot of information and a lot of excitement to continue supporting this work in the future. So, muito obrigada.